Good afternoon, Dr. Larock and Dr. Huffman. I'm going to be doing my head-to-toe assessment today. Here is my blank rubric. And then I have everything right there. So now I will begin. Hello, my name is Kira Bomarito. I am a student nurse here at SVSU. Can you give me your name and date of birth?
My name is Claire Castle. My date of birth is September 14th, 2005.
Perfect. And where are we?
We are in my dorm.
And what year is it?
2025.
Perfect. So you're wearing oriented ×3, so I feel comfortable continuing on with this assessment. So the assessment today is going to be a head-to-toe assessment. So that basically means I'm going to be assessing everything from the tip top of your head down to the bottom of your feet, just making sure everything looks normal and appears healthy. So before I begin that, I do have a couple questions to ask you. Do you have any allergies?
Nope.
Okay. Any pertinent medical diagnoses that I should be aware of?
Nope.
Any past surgical history?
Nope.
Are you currently on any medications?
Nope.
Any herbals or supplements?
No.
Are you in any pain right now?
No.
And then what is your exercise like?
I try to go 2 to 3 days a week.
Perfect. So we're mobile. Is that more cardio, more weightlifting, or is it a bit of both?
Bit of both.
Perfect. And then what is your diet like?
I try to eat 3 meals a day, so pretty normal.
Pretty normal. Perfect. So now I'm going to ask a bit more uncomfortable questions. These are going to be a little bit more personal, so feel free to answer to the best of your ability. Just know this is a safe space. Do you have any issues with incontinence, that is wetting the bed involuntarily, or peeing while sneezing or coughing?
Nope.
Okay. Any smoking use, that includes cigarettes, marijuana, or vaping?
No.
Any alcohol use?
Nope.
Perfect. So now that I've got a general health history on you, I'm going to start by collecting some vitals, beginning with that blood pressure.
Okay.
Do you have a preference on which arm I use?
We can use my left.
And then would you say you normally run low, high, or pretty normal?
Normal, I'd say.
Normal. Put your hand up like this, looking for that brachial pulse. Perfect. Okay, using my diaphragm, I'm going to place it on that brachial artery. Now I'm going to do blood pressure. Go ahead and relax your arm. Yep. Perfect. 126/82, which is well within that normal range that we like to see. Now we will check your temperature. 90.6, again, very normal. I'm going to take a look at your hands really quick. I'm just assessing for any clubbing, which would be oxygen deprivation to the fingertips. While I'm here, just check your capillary refill, which is symmetrical and within 3 seconds, which is what we want to see. So now I would feel comfortable taking a pulse ox on you. Go ahead and set your hand down. Beautiful. So that pulse ox is a 99, which again, well within that normal range. So now I will take your radial pulse. Can I see your wrist, please? I will take this for about a full minute.
Okay.
So that pulse was 78, respirations were 18. So both within normal limits, okay?
Okay.
So now I will begin. Usually we check head first, however I will start with your arms if that's okay with you.
Yes.
Okay, so I'm gonna check your arms for, check your radial pulses for symmetry. Nice and symmetrical. Doing the same here with that brachial. Beautiful. Now I'm just checking the overall arm. Skin color and temperature do seem to be okay. That muscle tone is nice and symmetrical. I do see a couple freckles here. Are those normal for you?
Yes.
Any cause of concern for those?
No.
Okay, and then this tattoo, how long have we had it?
For about a year.
Okay, has it caused you any issues?
No.
Perfect. Check your hands, which again, just checking that cap refill one more time, which is symmetrical on both hands and within 3 seconds, which is what we want to see. And no clubbing. Okay. Beautiful. So now I'm going to check your range of motion and strength. Okay, so I'm going to have my fingers, I want you to hold my fingers and then squeeze as hard as you can. Perfect. Now just like patty cake, put your hands underneath my hands. Now push up. Beautiful. Doing the same, opposite. Push down. Beautiful. Push me out. Amazing. Now push me in. Perfect. Now I'm going to check for crepitus in your shoulders. Crepitus is that cracking that we sometimes hear. So what I'm going to have you do is I'm going to have you do a swimmer's motion. Okay, I'm going to have my hands on your shoulders, just listening for any crepitus, okay?
Okay.
Go ahead and do that swimmer's motion. Perfect. Not hearing or feeling any crepitus. So testing this for the same thing on your wrists. So I'm going to have you roll them, just looking or listening for any crepitus. Perfect. So I'm not hearing any, so I'm not concerned with anything there. I will now check cranial nerve number 11. This is your accessory nerve. So what I'm going to have you do is I'm going to have you shrug. Go ahead and put them down. Shrug one more time. Put them down. Perfect. So cranial nerve number 11 does seem to be intact. So I'm not concerned with anything there. So now moving on, I'm going to look at your head. So I'm just going to assess your scalp here. I'm just looking for any lesions or any abnormalities that I can see. Not seeing anything abnormal right now, and the head does seem to be symmetrical. Does that cause you any pain?
No.
Perfect. So now I'm going to check her occipital lymph nodes, preauricular, postauricular, submandibular, submental, that cervical chain. I'm going to have you push your shoulders out forward like this, checking that supraclavicular. Then while I'm here, I'm going to check skin turgor. This is looking for any skin tenting that we would see if somebody was dehydrated, but I'm not seeing any skin tenting, so I'm going to say it's safe to say that I do think you are nice and hydrated. So now I'm going to look at your ears.
Okay.
Okay. So I'm going to palpate them. Any pain with that?
No.
And then I see you do have piercings here. How long have you had those?
Since I was a baby.
And have they caused you any issues?
No.
Perfect. So now I'm just going to check the back side of that ear. I'm also going to check inside. I'm looking for any buildup of wax or any obstructions. I'm not seeing anything. So going to the other side, I'm going to do the same thing. Looking at the back of that ear. Looking at the external. Not seeing any wax buildup or any obstructions. Okay, do you have any issues with hearing?
No.
Perfect. So now I'm going to take a look at your sinuses. So I'm going to push on them a little bit. Let me know if there's any pain or tenderness, okay?
Okay.
So this is your frontal. Any pain or tenderness?
Nope.
And then our maxillary. Any pain or tenderness?
No.
Perfect. Now I'm going to go under your eyes. Do you wear any contacts or glasses?
Yes.
How long have we been wearing contacts and glasses?
Probably since middle school.
Middle school. Have you had any issues with them? Any dry eye or anything of the sort?
Nope.
Perfect. And then are your eyes sensitive to light?
No.
Perfect. So what I'm going to do right now is I'm going to have you look down. I'm just checking your sclera, which are nice and white. I'm going to have you look up, checking that conjunctiva, nice and pink. Doing the same on this side. Sclera is nice and white. Go ahead and look up. Conjunctiva is nice and pink. So now what I'm going to be doing is testing cranial nerve number 3, your ocular motor nerve. I'm going to be using a light. I'm just checking for pupil constriction. Okay? Nice pupil constriction. So what I'm going to do now is something called accommodating. This goes with that cranial nerve number 3, that ocular motor nerve. So I'm going to have you look at my pen light, and I'm going to have my hand off to the side here. When I tell you to, I want you to move your sight to my hand. Okay? Go ahead and switch. Go ahead, go back to the pen, my hand, back to the pen. Perfect. So your eyes are accommodating. So your pupils are equal, round, reactive to light, and accommodate, which is all part of that cranial nerve number 3. So now I'm going to be checking more eye movement. So this includes cranial nerve number 3, the one that we just tested. And then I'm also going to be testing cranial nerve number 4, your trochlear, and cranial nerve number 6, your abducens. So what I'm going to do is something called the 6 cardinal fields of gaze. So what I'm going to do is I'm going to move my pen light. I want you to just follow it with your eyes. Don't move your head.
Okay.
Perfect. So it does seem that cranial nerves 3, 4, and 6 are all intact. I'm not concerned with anything there. I'm going to check light reflection on your eyes. So just look at my nose. Beautiful. Equal light reflection in both eyes. So now I'm going to move on to your nose. Do you have any issues with smell?
No.
Have you had any issues with deviated septums or polyps before?
Nope.
Perfect. So I'm just going to have you look up and take a peek in the nose. I'm looking for deviated septums or any polyps, which I'm not seeing anything, and your nasal mucosa looks nice and moist. So I'm not concerned with anything there. So what I'm going to have you do is I'm going to have you close one side of your nostril. Take a nice big deep breath in, let it out. Do the same thing with the other side. Nice big deep breath in, let it out. Any problems with that? No? Perfect. So now what I'm going to do is test cranial nerve number 1, your olfactory nerve. This is just your sense of smell, okay? So what I'm going to have you do is I'm going to have you close your eyes. I'm going to put something under your nose. I want you to take a smell and then let me know what that smell is, okay?
Okay.
Go ahead and close your eyes.
That smells like coffee.
Perfect. So cranial nerve number 1 does seem to be intact. I'm not concerned with anything there. So what I'm going to do now is I'm going to look at your mouth. So I'm going to have you open for me. I'm just taking a look at that oral mucosa, which is nice and pink and hydrated. Not seeing any cavities, fillings, or any obvious cracked teeth. Go ahead and smile for me. Just again checking those teeth, which look good. Your lips look nice and hydrated, so I'm not concerned with anything there. What I'm going to have you do now is I'm going to have you stick your tongue out. I'm going to have you move it around a little bit. This is going to test cranial nerve number 12, your hypoglossal.
Okay.
Go ahead and do that. Go ahead and move your tongue. Beautiful. So it does seem like cranial nerve number 12 is intact. Now what I'm going to be doing is testing cranial nerves number 9 and 10, your glossopharyngeal and your vagus. What I'm looking for is for your uvula and your soft palate to move up and forward. So what I'm going to do is I'm going to have you stick your tongue out. I'm going to put my spoon on it. I'm going to have you say ah. Do you have any problems with gagging?
No.
Perfect. So I'm going to have you go ahead and stick your tongue out. Go ahead and say ah.
Ah.
Beautiful. So your uvula and your soft palate did move up and forward, which is what we wanted to see. I also do see you still have your tonsils, correct?
Mm-hmm.
Didn't see any problems with them back there either. I will now test cranial nerve number 5, your trigeminal. So I'm gonna place my hands on your jaw. I just want you to clench for me. Go ahead and unclench, clench, and unclench. Not seeing any problems so far. I'm gonna have you close your eyes. I'm gonna touch a couple places on your face. I want you to tell me where I'm touching, okay?
Okay. Forehead, right cheek, left cheek, chin.
Perfect. So cranial number 5, your trigeminal nerve, does seem to be intact. So what I'm gonna check now is cranial nerve number 7, which is your facial nerve. So I'm gonna have you make a happy face, make a sad face, make an angry face. Now puff your cheeks out. Perfect. So cranial nerve number 7 does seem to be intact. I'm not concerned with anything there. Facial, face does seem to be symmetric. So again, not concerned with anything there at this point. So now what I'm gonna do is I'm gonna look at your trachea. So I'm gonna have you lift your head up a little bit. I'm just making sure it's nice and aligned, which I'm not seeing any problems, so I'm just softly touching. Not seeing any problems with that. What I'm gonna do now is I'm gonna auscultate your carotids. I'm listening for a bruit. Bruit is that whooshing sound that we sometimes hear when there is an obstruction or an aneurysm within that artery. Okay?
Okay.
Perfect. So I'm not hearing any whooshing, so I'm not concerned with anything there. I will now what we call palpate your carotids, okay?
Okay.
Nice and strong. Doing the same thing on this side. Also nice and strong. Not concerned with anything there. So now what I'm gonna have you do is I'm gonna have you turn to your side a little bit.
Okay.
I am going to check your thyroid. So what I'm going to do is I'm going to find your Adam's apple. I'm going to push your thyroid in, just displacing it. I'm going to have you swallow. Maybe a little uncomfortable, just bear with me, okay?
Okay.
I'm just coming up behind you here. Going to displace, go ahead and swallow. Perfect. Again, displacing, go ahead and swallow. Perfect. Didn't feel any masses or anything concerning there. So now I'm going to move on to your lung assessment. Okay? So I'm just going to move your hair out of my way here. So I'm looking at skin temperature. Is it okay if I undo this?
Yes.
Okay. Looking at skin temperature, skin color looks good. I do see that you have some freckles here. Are those normal for you?
Yes.
Perfect. Skin temp and color look good on the neck as well. So now I'm just looking down the spine, which looks aligned. Do you have any history of scoliosis?
No.
Perfect. So now what I'm going to do is I'm going to check your diameter of your chest.
Okay.
So I'm going to put my hands right here. I'm going to have you take a nice deep breath. Perfect. So I see you have a nice 2 to 1 AP diameter, which is what we want to see. So now I'm going to listen to your lungs with my diaphragm. Every time I place my diaphragm down, I'm going to have you take a nice big deep breath. It may be a little tiring. Let me know if you need a little break, okay?
Okay.
Is it okay if I move your brow up a little bit?
Yes.
Perfect. So So it does sound like your lungs are clear, and I'm not hearing any crackles or wheezing, so I'm not concerned with anything there. So now I'm gonna move on to percussing. So you're gonna feel me tapping on your back a little bit. Shouldn't be painful, but let me know if you do feel any pain, okay?
Okay.
You can just breathe normally while I'm doing this. Perfect. So I am hearing resonance, which is what we want to hear. I'm not hearing anything dull, which means I'm not concerned about any fluid or anything in your lungs.
Okay.
Okay. So now I'm gonna have you flip around and I'm gonna have you lay down on this pillow. Perfect. So I'm gonna take this pillow away for just a second. Go ahead and lay your head down. I'm gonna have you look to the side of the wall. I'm just checking for any JVD, that's jugular vein distension, that we would see if there was a fluid volume overload. However, I'm not seeing anything. Take a look at me. Perfect. Again, not seeing anything. If I were seeing some JVD, I would lift the head of the bed at 45 degrees. If that still persisted, I would be concerned with fluid volume overload. But I'm not seeing anything, so I'm not concerned.
Okay.
Go ahead and lift your head up. Give you your pillow back. Okay. So now I'm going to move on to a cardiac assessment. Is it okay if I pull this down?
Yes.
Okay. Okay. This is my patient's right side. This is my patient's left side. So I'm going to start by finding your aortic valve. So that's going to be the second intercostal space on your right side. So for this, I will listen with both my diaphragm and my bell.
Okay.
I will be pushing, so let me know if there's any pain at all.
Okay.
Clavicle, space, rib 1, space, rib 2, space. So this is that aortic valve. Listening with my diaphragm for 1 lub dub. Beautiful. Switching over to my bell, listening for any murmurs. No murmurs present. So now I will be moving on to your left side, your pulmonic. So this is going to be second intercostal space down on the left side.
Okay.
So again, just some more pushing. Let me know if this is causing you any pain at all.
Okay.
So clavicle, space, rib 1, space, rib 2, space. So this is going to be our pulmonic. So listening with that diaphragm again for 1 lub dub. Beautiful lub dub. Going around to my bell, listening for a murmur. No murmur present. So staying here, I will now move down to the third intercostal space on that left side. That is going to be our herbs. That's going to be the strongest heartbeat in the body. So rib 3, intercostal space. So listening with my diaphragm again for 1 lub dub. Beautiful lub dub. Switching over to my bell, listening for any murmurs. No murmurs present. So now moving down to the fourth intercostal space. Rib 4. Is it okay if I lift this up a little bit?
Yes.
Intercostal space, right here. So this is going to be our tricuspid. So with my diaphragm again, listening for 1 lub dub. Perfect. Switching over to my bell, listening for a murmur. no murmur present. So staying on that 4th intercostal space, I will now move down to the 5th intercostal space. This is going to be our mitral, otherwise known as our apical pulse. So this is rib 5, intercostal space, moving mid-clavicular. So this is going to be the most accurate heartbeat in the body. So again, with my diaphragm, listening for 1 lub dub. Perfect. Switching over to my bell, listening for a murmur. No murmur present. So holding my spot here, I'm going to switch back over to my diaphragm. I'm going to listen to this for 1 full minute.
Okay.
Perfect. And then that heart rate was a 74, which is normal. So now I will put this back up as I'm done with your cardiac assessment. So now I will move on to your abdomen assessment. Is it okay if I pull this up?
Yes.
So before I start this assessment, I'm just going to take a peek, looking at symmetry, looking for anything abnormal. I do see that aortic pulsing, but it is above the umbilicus, so that is normal. So again, taking a peek from the bottom as well, not noticing any abnormal masses or anything concerning. So now what I'm going to do is begin by auscultating, which is again, that's listening with my stethoscope. I'm just going to listen to your GI tract. I'm looking to hear 5 gurgles, starting in your right lower quadrant. I will be listening with my diaphragm. Perfect. Moving up to that right upper quadrant. Perfect. Left upper quadrant. Amazing. Then left lower quadrant. Nice loud gurgles there, so I'm not concerned with anything at this point. While I'm listening with my stethoscope, I'm going to take a peek at your arteries in your abdomen, starting with your aorta. So what I am going to do is I'm going to lightly touch your belly button from the top right bottom of your bra. I'm going to meet them together, okay?
Okay.
Listening. Here, New York. No buoys there. Listening to that renal. Renal. Down to that iliac. And then that other iliac. No buoys present, so I'm not concerned with anything there. And then I'm not concerned about skin temp as well. Everything looks good. Besides that little freckle there, is that normal?
Yes.
Perfect. So now what I'm going to do is I'm going to percuss, or I'm going to palpate, no, I'm going to percuss. Percussing is Again, that little tapping shouldn't cause any pain, but let me know if it does, okay?
Okay.
Listening for tympani. Nice tympani, nothing dull, so I'm not concerned with any abnormalities in that GI tract. So now what I'm going to do is I'm going to percuss up your right side, just looking for that liver.
Okay.
Okay, so that liver is going to be right there as that's where it became dull.
Okay.
So now I'm going to do some light palpation, just following your GI tract. Let me know if there's any pain or tenderness with this, okay?
Okay.
So I'm lightly starting in that right lower quadrant. Just gonna palpate slightly. Any pain or tenderness?
No.
Perfect. So now I'm gonna do a little bit deeper palpations. Again, just let me know if there is any pain or tenderness.
Okay.
Starting in that right lower quadrant again. No, I did not feel any abnormal masses or anything, so I'm not concerned with anything there. I will now check your femoral pulses. This may be a little uncomfortable, but I will keep you covered. If it does become too uncomfortable, just let me know.
Okay.
Okay, so I'm gonna come on this side. Going to reach my hands down your shorts here. Just checking for that femoral pulse. Perfect, and then I am right here. And I'm gonna check the other side. Beautiful, again, I'm right here. Now I'm gonna check for symmetry. Nice and symmetrical. Now I'm gonna listen with my bell, just listening for any breweries, okay?
Okay.
Okay, and then I am right here. Going again on the other side. I am right here. No breweries present, so I'm not concerned with anything there. So now I'm going to move on to your legs, okay?
Okay.
We can go ahead and pull this down. Cover you back up there. So I'm gonna take a peek at your legs, just assessing temperature. Color looks good. Just a few freckles, those are normal for you?
Yes.
Perfect. So now I'm gonna look at symmetry of those popliteal pulses. Nice and symmetrical. Is it okay if I remove your socks?
Yeah.
Okay, checking symmetry on those posterior tibialis pulses. Nice and symmetrical. And those dorsalis pedis pulses. Perfect. Nice and symmetrical. While I'm down here, I'm just gonna take a peek in between those toes. Not seeing anything abnormal there. I'm gonna check cap refill on these toes while I'm down here. Okay, cap refill is less than 3 seconds, so I'm not concerned with anything there. Looking at the bottom of your feet, I'm not seeing any dryness or flakiness or anything concerning, no pressure ulcers or anything like that. So again, not concerned with anything there. Okay, so now what I'm gonna do is a sensory test.
Okay.
So this is gonna test for any peripheral neuropathy or loss of sensation in those legs. So what I'm gonna do is I'm gonna have this Q-tip. It's got one sharp end, one dull end. What I'm gonna do is I'm gonna place that on one spot in your leg. I want you to tell me where it is, which side it is, and if it's sharp or dull. before we begin, I'm just gonna show you, this is sharp, this is dull.
Okay.
Okay, so I'm gonna have you close your eyes.
Sharp.
Where is it?
The left thigh.
Perfect.
Dull on the right thigh. Sharp on the left knee. Dull on the right knee. Dull on the left shin. Sharp on the right shin. Dull on the left foot. Dull on the right foot.
Perfect. So you did get all of those right, so I'm not concerned with any loss of feeling or peripheral neuropathy. Okay? So now what I'm going to have you do is I'm going to have you sit up for me. I'm going to have you swing your legs this way. Any dizziness?
No.
Perfect. So I'm going to check for your cerebellar function. So I'm going to have you throw up an OK sign for me. Touch each finger to your thumb. Now do it as fast as you can. Perfect. So now I'm going to have you place your hands on your thighs. Flip them up. Flip them down. Do that as fast as you can. Perfect. So I'm going to do one more cerebellar test. What I'm going to do is I'm going to have my pen in front of you. I'm going to have you touch your nose, touch my pen. I'm going to move it to a couple of different places, okay? So go ahead and touch your nose, and touch my pen, nose, pen light, nose, pen light, nose. Perfect. Not concerned with any cerebellar function. Seems to be working fine. So now I'm going to take a peek at your legs. I'm going to do a couple strength tests on them, okay?
Okay.
So I want you to lift your thighs up. Perfect. I'm going to have you I'm going to check for crepitus in your knees really quick. So go ahead and kick. Perfect. No crepitus. So again, I'm going to have you put your legs up a little bit. Pull me down. Perfect. Push me up. Amazing. Push me out. Now push me in. Beautiful. So I'm going to check for crepitus in your ankles. So I want you to roll your ankles for me. Perfect. Didn't hear any crepitus. That's that cracking again that we talked about. So I'm not concerned with anything there. So now I'm going to have you push on my hands like a gas pedal. Beautiful. Now push me up. Perfect. Not concerned with anything there. So now I'm going to put your socks back on. Gonna use some hand sanitizer. I was just touching your feet. Now I'm gonna check your patellar reflex. So I'm gonna have you close your eyes for me. Beautiful. No issues there. So now I'm gonna put your shoes on you.
Okay.
Perfect. So what I'm going to have you do now is I'm going to have you stand up. I'm going to have you have your feet shoulder width apart, hands at your side. I'm going to be standing next to you. I'm going to just test for your Romberg test,
Okay.
which is cranial nerve number 8, your vestibulocochlear. So I'm going to have you close your eyes. I'm just assessing for any swaying. Okay? Stand up. Go ahead and close your eyes. I'm right here. I'm gonna listen to this, or gonna study this for about 10 seconds. Perfect. So I didn't see any swaying, so I'm gonna give you a negative Romberg test.
Okay.
So at this point, I'm gonna have you walk. So I just want you to take a couple normal steps this way, okay?
Okay.
I'm gonna be right by your side. Beautiful. I'm gonna have you turn around. I'm gonna have you do the same thing, but I'm gonna have you do heel to toe.
Okay.
Okay. So I'm gonna have you turn around. I'm gonna have you do the same thing, but I'm gonna have you do the same thing, but I'm gonna have you do heel to toe. Okay. So I'm gonna have you do the same thing, but I'm gonna have you do heel to toe. Okay. So I'm gonna have you turn around. I'm gonna have you do the same thing, but I'm gonna have you do heel to toe. Okay. So I'm gonna have you turn around. I'm gonna have you do the same thing, but I'm gonna have you do heel to toe. Okay. So I'm gonna have you turn around. I'm gonna have you do the same thing, but I'm gonna have you do heel to toe. Okay. So I'm gonna have you turn around. I'm gonna have you do the same thing, but I'm gonna have you do heel to toe. Okay. So I'm gonna have you turn around. I'm gonna have you do the same thing, but I'm gonna have you do heel to toe. Okay. So I'm gonna have you turn around. I'm gonna have you do the same thing, but I'm gonna have you do heel to toe. Okay. So I'm gonna have you turn around. I'm gonna have you do the same thing, but I'm gonna have you do heel to toe. Okay. So I'm gonna have you turn around. I'm gonna have you do the same Perfect. So now you can have a seat now. So I didn't see anything wrong with that gait. You have a normal gait, normal balance. Again, now I'm going to give you a 23 out of 23 on the Braden scale. As you have proper nutrition, you're mobile, you exercise quite a bit, and you don't have any issues with incontinence. So that is the end of my head to toe. Thank you for participating.
Thank you.